Okay, hello everyone. We're going to discuss dementia station, and I'm having here with me Dr. Shahriyar. Thank you so much for joining me and for allowing me to record your voice. So I really appreciate it. Let's get started our station.
Hello.
Hello, Dr. Shahriyar. How are you?
Yeah, I'm fine. How are you?
I'm very good. Thank you. So thank you so much for this.
Yeah, thank you to giving me.
Yeah, my pleasure. But I know, like, when I put you in YouTube, sometimes it's not, even in the future, you may change your mind. You say, why did I let her to record me? But anyway, I took your permission.
It's okay.
All right, thank you so much. Okay, so let's start our station. So your patient is, we're not going to put any timer because I'm just, I need to cover everything and I need you, especially the IBS part, don't miss it. So I need you to take your time. Don't panic with the time management. In your exam, you can do whatever you want to do, but now, yeah, like just be relaxed. Even last time, like when I asked Selena, don't worry about the time, we finished before time. So it was around less than 8 minutes. So I think when you are relaxed, you can manage the time better. So take your time, say anything you want to say for me. Your task is Mrs. Walker has been admitted to the hospital by end stage dementia, and she has been losing weight, and also she's not eating enough. She received IV fluid in the hospital, and she has done all kind of investigations, include blood and scans and CT. Everything was normal. Yes, this is normal process of dementia. So multidisciplinary teams decided just palliative cares now is suitable for this patient, and any kind of invasive treatment is not good for her, it's not going to benefit her. So you need to call her daughter and discuss with her this news and also address her concern. So I have lots of concern, please remember to ask me. All right. So we have dementia here, we have palliative care treatment, and we have a daughter who has few concern.
Am I in the like GP or hospital?
Hospital, has been admitted to the hospital, but okay. She's not going to be kept on hospital, so it's going to be discharged, and you need to discuss with the daughter the options, like where to stay. But no treatment in the hospital is going to benefit her. It's just palliative care, could be anywhere. Okay. At home, at care home, wherever they want. All right, so when you are ready, start.
The patient name and age.
Okay, so Mrs. Walker, she's 82. Okay. And the daughter name is Annie.
Okay.
Telephonic.
Should I start?
Yes, please.
Hello.
Hello.
I'm Dr. Shahriyar from the hospital. May I confirm whom I'm talking to?
Yes, hello. My name is Annie. Hi, doctor.
Hello. I'm here to talk about patient from our hospital. May I confirm how are you related with Walker, Mrs. Walker?
Yes, I am her daughter.
Okay. So can I confirm few details before starting the conversation with you?
Yes, that's fine.
Okay. Can you please confirm your first line of address, please?
Yeah, XY Street.
And can you confirm your mother's age, please?
82.
Okay. Thank you for answering my questions. Like if the call drops, is it the right number to call back to you?
Yes, same number.
Okay, thank you. Okay, so how may I help you today? I understand that your mother is admitted in our hospital, so I'm here to talk to you and address your concern. So may I know how may I help you today?
So doctor, you called me, so I don't know.
Okay, so yeah, your mother is in the hospital, and he is treated by us, and we have already done some investigations, and fortunately every reports came out normal, and we are planning to discharge her now from the hospital.
All right.
Okay,
Is
so
she fine? Yeah.
yeah, she's fine now. She doesn't have any medical condition right now other than this dementia. So, before talking about her further management, can I have a quick recap of what happened actually?
Yes, fine. Yes, please.
Okay, so may I know why did you admit her to the hospital in the first place?
Yeah, she has been losing weight, and she had been reluctant to eat any food. That's why I admit her to the hospital.
Okay, so for how long is she's having this problem?
Last week.
Okay, she's not taking food for last week.
Yeah.
Okay, so what's she diagnosed with any medical condition?
Yes, she has high blood pressure. She has diabetes. She has high
Mhm.
cholesterol.
Mhm. Yes. Any other medical condition that you know of?
No, that's all.
Okay, so, how was she managed for her condition like high blood pressure, high diabetes, high blood sugar, and all?
Yeah, they were all controlled before she admitted. I don't know now.
Okay. And was she taking her medication as prescribed before
Yes,
admission?
yes, yes.
May I know who looks after her?
Me?
Okay. So, do you work any other place, or you stay in the house and look after her always?
Sorry, say again.
Okay, so do you do any job, or just you spend the time with your mother in the house?
Yes, I used to have a job, but
Mhm.
I cannot work anymore because my mother condition is been deteriorating. So I just look after her all this time.
Okay. I know how are you managing yourself while looking after your mother?
In which term?
Mm, as you are not working, so are you getting any support from the NHS
Uh,
regarding?
Not really, doctor. Yes, if you can tell me about that, would be great because I have no idea.
Okay. Okay. I'll talk about this in a couple of minutes, and I just want to update you regarding her current health condition actually. So once she was admitted in our hospital, we have managed her for with necessary medication, and we have done some tests, and everything came out normal, as I have told already. And now she is fit for discharge, and he told that she is not eating well, and she is diagnosed with dementia now, and because of this condition she is not eating well.
Yeah, she's not diagnosed now. She has this dementia 3 years ago.
Okay, okay. Sorry, I have missed that part actually. So yeah, for this reason, actually, she is not like uh, mm, mm, eating well actually. So do you know about the dementia?
Yes, yes, I know everything about dementia. So, like, I have visited lots of clinic with my mom, dementia
Mhm.
clinic, and yes, the GB also gave me information leaflet. So I know everything. Yeah.
So what may I know what do you know about dementia? What happens when someone has dementia?
They can lose everything, like thinking and communications. Um, she's unable to do anything for herself. Yeah.
Okay. Okay, so before admitting here, could she manage herself? Like, could she handle her day-to-day activities?
No.
Okay, could she concentrate? Could she found the right words for talking?
Not really, no.
Okay, and you said she's not also eating well. Okay, so did you like you told about that you went to dementia clinic? So did you talk to anyone in the dementia clinic about that, about the management of her?
Uh, yes, she had management in place, and I was a carer for her. But
Mhm.
I believe that now she's getting worse. So I'm expecting you to tell me something different regarding the management.
Yes. So for now, I'm talking about the management right now. So as she's now discharged from the hospital, we planned about like palliative care actually. So have you ever heard about it?
Not really.
So palliative care is something what we provide to a patient during their end of their life. So it is like done by a multidisciplinary team where it is comprised of like a physician, a doctor, and the other staff, including the occupational therapist and mm, like any physiotherapist. Like these people actually made a team, make a team, and we provide support throughout this team actually to a patient.
Mm,
Am I
so
making sense to you?
not really. I didn't get it. Are you going to keep her in hospital?
No, we are not going to keep her in the hospital right now. We are going to discharge her and we will assess everything, how to manage her, and we will like take the best care for her by providing appropriate medication, and we'll also provide with proper nutrition as well. And mm, we'll look for like if like she's not affected by any infection, and we'll also manage about her urinary and bowel management as well. So we'll look everything for her aspect of care, and we'll do our best to manage her. And for this actually we have this palliative care team, and which will be made of these like doctor and this therapist and this type of people actually.
All
Have
right. So
I cleared so far?
yes, can they come to her at home?
So they will come like it depends actually. Like if she like if they are required to come to the home, they'll come and provide necessary support. For example, if she has problem with her mobility, like if she can't walk, the occupational therapist will come and they will assess your house, and they will take necessary steps to manage that. How can she move from her place from one place to another? And for like if she has difficulty in moving her hands or limbs, the physiotherapist will come and they will help her regarding this aspect as well. And if she has developed an infection or anything, the doctor will provide with the medication.
Okay.
How do you feel about?
Yeah, just one second. Can you just raise your voice? Some people said they can't hear well in the chat. They're writing down. Yes, so you told me lots of information. I can't take them all together, but uh, just you told the most important information you told me, like they can come at home because I need to keep my mom at home. I don't want to send her any place, uh,
Okay,
anywhere. Yeah.
it is really understandable that you can't like take her to any place, but our palliative team like will take care of it, and they will provide necessary support regarding this. uh,
Okay.
are you understanding me?
Yes.
Okay, so any do you have any other concern today?
So you told about you going to look after her bowel movement, but my mom, she had some problem. She can't control herself, like she wee and poo at herself. So
Okay,
how you going to manage that?
so for her we can insert a flexible tube through her like private parts, so that it can be drained to to a bag. And for the poo we can use a diaper, and then we can change it. Like the carer who is taking care of her can do that.
All right, yeah, that's fine. So you're going to send the care for her as well.
Okay, so like you told me that you are the carer for her. So if you want to be the carer, so I can arrange it for you as well. So NHS actually provide payment for those carer. So if you apply for this, we can also arrange it for you as well. And if you don't want a different carer, we can also arrange that for your mother as well. So
Yes, yes, yeah. Arrange someone to help me. It's too much, doctor.
okay, so I'll talk to my senior and I'll arrange everything like a carer for your mother as well.
Okay, thank you so much.
Do you have any other concern?
No, that's fine. I think is good. Yeah. So I don't want. I don't have any question. I can't think about any question at the moment.
Okay, so if you have any questions and if you have any concern regarding your mother and if you want to know about the treatment or any management plan, just come back to us or call us anytime. And I will also send some leaflets to your house so that you can understand better about the dementia and the management. How does it sound?
Yeah, that's good. Yeah, that's fine.
Do you have any other concern?
No, doctor. Thank you so much.
Thank you.
Thanks a lot. Okay, so
I was not I was not in well structured actually. I was thinking what to ask and what not to, and it was mixed actually. The data gathering was not good.
yeah, and despite the fact that you're really good, I know you, so I was really surprised. Like it wasn't you today. Maybe you don't like YouTube things. You don't like to go popular. Seriously, like yeah, it wasn't your performance like I used to. But anyway, no problem. You covered lots of stuff there, but let's see what you missed. So this patient already been diagnosed with dementia and admitted because of her weight and feeding problems. So the dementia assessment itself is not. We're not going to ask the same like the dementia station we did in the past, detailed history about the memory and these things. However, we need to just, because we're going to send a carer for this woman, we need to know, you don't have enough information in the task. So we need to find out like what exactly this woman can do and what can't do. And I'm suspecting that she can do nothing because it's end stage dementia. But anyway, it's good to ask like about her communication, her sleep, and
Mhm,
you asked me some of them for sure, but not everything. Her mood, if she has any behavioral problem, because sometimes they can be aggressive and
mhm,
yeah, tearful. They need some psychological support as well. And urinary and fecal incontinence. So I just mentioned them in the management. So
mhm.
you can ask from the history, like,
Okay,
and
yeah. I could ask about the how did she manage with her urine and bowel.
yeah, and how independent she was before she was admitted to the hospital. Like, does she able to do anything at all, like dressing, bathing, whatever, like look after herself? Does she able to do anything, or she's completely dependent on you? So in this case, just for the carer, like the even like the carer, she needs carer. This patient need carer for 24 hours to be with her. Like, is she's seriously difficult patient. So
Mhm,
we're going to offer her the same treatment at hospital, but it will be at home. But it depends on the daughter. So you need to ask the daughter like. What would you prefer to send your mom to the home care or to the hospice or to stay at home? And you need to explain them like which is which. Like tell her like if you need her to stay in a care home, there's lots of nurses and
So
yeah,
you like the case. I actually like couldn't understand the case actually. So in the beginning, like should I ask? I thought I was asking the concern of her. I was addressing her concern. So I didn't think that I was giving her update. So I asked, "What? How can I help you?" And he said, "Like
yeah,
you want update." And later didn't understand about the thing you told me. Like the care. So carers, you told me that you are the carer. So should I talk about that, like after
Yes,
this?
so if I told you I am the carer, ask me like, how do you feel about looking after your mom? And how are you managing? Do you need any help? We have carers if you want, we have home care. So you need to explore it in depth, like, yeah. And someone asking in the chat, how would we explore more about sudden fecal and urinary incontinence? Yeah, so just, is your mom able to control her bowel and urine? That's all. So if she's able to go, and if she go able, if she said yes, still we can ask, is she able to go to the toilet by herself, or you need to take her? So just it's just this some information for the carer. Is not when she comes, she need to look after her in these things. And you asked me about financial as a daughter, like you asked me about my financial situation, but also asked me about my mood and in general, how am I coping with this? Do I need any help or not?
Okay.
And also a very important information when in any end of life, we need to ask about, for example, does she have any legal documents regarding management plans? So they write their wishes and it has to be documented legally. So verbal wishes are not taken seriously, but if there is legal papers to show further management of plan, like for example, do not resuscitate, whatever, like anything, she maybe need to be look at home or social or at home or hospice, whatever. So if the patient discussed her wishes before and being written, so we can discuss this with her as well. And you discussed the about the palliative care. Good. So just because it's too much information about palliative care, so just tell her in general broad line like nutrition, feeding. Just we will make sure she's going to have comfortable life and have a better quality of life rather than invasive treatment. Yeah, because it depends on the time. You may not find time to explain everything in palliative care, but if you have time, you can explain about everything like
I have a
nutrition.
question actually.
Sorry, yeah.
When I was talking to the patient, like the daughter, and I was asking what happened actually, and like how, like should I take a detailed history of what happened and how was she before
Yes,
that, what the
yes.
medical.
Exactly. If it's not written in the task, you need to ask. If everything clear for you in the task, okay. But you need to ask how any relative when you start the station, what do you know about your father mother condition? So it's really important to start with this question. So she may tell you everything and you save your time. You don't need to mention the information again. She will tell you has been admitted to the hospital and I was told this end this stage, whatever. So you need to ask what do you know so far, and then you can ask past medical history and then try to discuss your own things after that.
Okay.
Yeah. So how do we suggest about dementia friendly home to involve occupational therapist? Yes, so so not only dementia, all elderly people, they need occupational therapist, and those people concerned by adjusting the home environment according to the patient needs. So you will tell her, yeah, so part of the multidisciplinary teams are going to look after your mom. We will send you occupational therapist to make sure your mom had a comfortable life there in the home if she wants her to stay at home. But if she said she wants to send her to the care home, so it's already thing done there. You don't need to send occupational therapist to the care home. So it depends. So first we'll ask the daughter where you want your mom to be looked after in the end stage of her life. Yeah. What question do we ask to find about causes of sudden deterioration in dementia? It's not really important to know what caused her dementia. She has dementia, she end stage. We don't need to find the cause because it's untreatable anyway. So we'll save our time for discussing the management rather than spending long time in the history. because it could be just the age. She's 82, she's elderly, and dementia can deteriorate quickly without any reason. And even she has a risk factor as well, like high blood pressure, diabetes. Maybe they wasn't controlled enough. However, we cannot reverse things back. What is done is done. We need to think about further management plan and how we can support the mother, but mainly the daughter, psychologically and financially is really important in these situations. So we will ask her first about regarding financial support. Do you have an idea about the financial support from the government or not? If she said she knows, you don't need to waste time there. If she says she doesn't know, you can just explain about carer, carer allowance, and then you will tell her there is lots of kind of benefits that has been offered by the government. I will give you patient information leaflet regarding that. So don't go into more details. Just the most important one is the care allowance, as Dr. Shahriar mentioned it to me. So this is, we can give it to you if you chose to be a carer for your mom, you will get money. Okay, does the mother have mental capacity in advanced dementia? Yes, it's a very good question, but obviously no. Yeah, so I don't think she will have mental capacity, but I think we have to confirm, like just ask about your her mom mental, like does your mom has any mental capacity or not? You can ask directly the daughter, like for example, is your mom able to make her own decision regarding treatment, or you are the one who look after her? So we'll ask the power of attorney for the daughter. So we will ask her like if you are the legal person who can make, like, are you the legal decision maker on behalf of your mom? You can ask these questions because in end stage dementia, most likely she doesn't, even if like moderate dementia, she will not, they will not have mental capacity. But anyway, so just ask her, are you the legal decision maker in case of your mom losing her mental capacity? Just ask these questions. Okay. Should we ask what the mother would want in her end of life first, or worry about confidentiality, or just we will ask about so confidentiality in the task is written for you. Consent has been given to the mom and to the daughter to discuss everything with her. Consent has been given to discuss the management plan of the daughter, so there is no confidentiality issue here. But regarding the wishes, mother wishes, so this is one of the questions, the extremely important question we will ask, and I mentioned it earlier. I told about, does she have any document regarding management plan or any wishes? And it has to be recorded to be taken seriously. Yeah. What else? Is there any question? Yes. If you have any question, please write. Yeah, so in general, we have a couple of dementia stations. Like one of them, this one is mainly regarding the daughter and end of life. And when it comes to palliative care, just we will tell her, like, we're going to offer her supportive treatment, and invasive treatment is not it has no benefit in your mom case, so it will not benefit your mom. And would you like me to discuss with you the management options? So we're going to look after her nutrition and, for example, exercise her joints and keep mouth hygiene and look after her, as you mentioned. For example, for urine or incontinence, Dr. Shahriar, you said about catheter. No, it's not good options here. We'll just give them diaper and waterproof mattress, because this is long-term condition. It can cause infection in the visitors. So we don't do catheter in case of urinary incontinence in elderly. We just give them diapers and waterproof mattress. Yeah.
Okay.
Yeah, and just you will send her carer to clean her and make everything clean for her. For example, the food, you can give also some advice regarding food. So if she's like, we will just treat them like children. So we can just encourage them to eat, spend time with them, because they will be they will be dementia people, they will be reluctant to eat. So just you need to just like beg them to eat. So you will eat with them, give them the food in their hand, and give them small meals, frequent time a day, and just encourage them like just like babies. That's all about it. And you can just, if they can't swallow, you can soften the food for them, like puree, or just blend the food for them. Yeah. And also you can give some advice regarding sleep hygiene. If you can just switch the light off for your mom to help her sleep, and whatever you can discuss anything here. But the most important thing is the station, because it's really, there is billion of information to say. Just always ask the mother, because even the woman being diagnosed 3 years ago by dementia, so you will ask in the history when your mom has been diagnosed with dementia. So she will tell you, for example, 3 years ago. So obviously she has been gone through a lot through this past 3 years. She know better than us, even as the doctors, about regarding dementia. So take all the information from the woman, and when the simulator, you ask them and they know the information, they will tell you everything in one line. So they will save your time and you don't need to go into detail. So always just use this habit to ask more than to give. So examiner are not interested in the amount of knowledge you have. They're interested in the way you communicate to the patient. So always ask the patient before you offer any information, even if you think is not like the patient cannot know them. Just ask. You, we will never know. Maybe the relatives, doctors themselves. So just ask first and then offer the information. And even if they don't know the information, ask them how much you need to know about this. So you will be good communicator, and also you will save sometimes, because it's really too much to say if you go into everything. So in general, all dementia station, just I'm summarizing again. 1 second, let me just calm myself a little bit. Okay, hello. So what I was saying, just a quick recap of all dementia stations. If it is like we're talking to relatives in any Plab 2 station, we need to know, tell them how do you far know about your father or mother conditions, and even if when they tell you, ask them again, has anyone told you about this recent news, whatever news, like whatever you have in your hand to tell the patient, has anyone discussed with you the result of your mom scan, whatever. So according to the task, just ask again, has anyone discussed this with you? And in this one we discussed today, just our aim is to discuss the palliative care with the mother, and to decide further plan of management with the daughter, and to take the daughter itself as part of the management. Like the daughter herself, the daughter wishes, like if she wants her mom to stay with her at home, to go to hospice, or to go to hospice, or to go to care home. So we will discuss with her those options as well. And in the history as well, you need to assess the severity, or the how much care the mom wants. But anyway, because if she has palliative care, I think she needs high level of care. So you will tell her, just we will just, if she opt to, for example, home care, tell her we'll send you all the team to look after your mom. There will be a nurse, a carer, and doctors. So anyone will be involved in your mom care, and she will be followed closely. And we will make sure, just you will explain the palliative care. she's comfortable and she has a best quality of life she need to have during her last days. And when you talk about like end stage, you need to just break it a little bit like bad news when you're telling. So you told me sharply your mom has been decided for palliative care. So try to a little bit just break it gradually to the daughter and ask her about her feelings. So lots of IBS sentence today you didn't give me. So I think it's really important to acknowledge the daughter feelings and even positive language. The daughter, she's been looking after her mom. We need to praise her for that. So I think there could be lots of IBS sentence here. Sorry. All right. So the other station, like dementia assessment, is just head-to-toe assessment. Like we still is not diagnosed. So the daughter concerned about her mother, and the mother was the patient. So it just, you can ask any question you need to ask. So starting with the memory problem itself, and you elaborate that in depth, and like if she's able to recognize people names, if she missed any important appointments, this kind of questions to assess the memory. And also you will ask about mood again, and sleeps, appetite, and her walking, her hearing problem, vision problem, and how independent is she, and dressing, shopping, and home environment, and who looks after her. Again, and we will check risk factors for dementia. And this is the other station. There is the station about risk factors. So mainly we will be considered about vascular dementia. So so we'll ask about diabetes, hypertension, cholesterol, smoking, alcohol, all these kind of things. And if it is dementia assessment station, we will do, for example, mini mental state examination. But in this case, of course, we don't need to do anything, just about palliative care has already been decided. It's just the management is to discuss with her this palliative care and give her the support, emotional and financial support. I think it's all about it. If you have any questions, please write down for me. And please always focus on these communication skills. So the examiners, they're obsessed about it rather than anything else, rather than your medical knowledge, everything. So just please, remember to tell as much as you can from IBS sentence. In addition to that, explore whatever is talking to you, their ideas about the topic, their concern and their expectation. Explore that in depth and address it back in this at the same time. Even don't delay it. So this will give you more marks. Otherwise, sometimes passing Plab 2 tricky for some people just because they focus in the management part and in the script part rather than just exploring the patient ideas and concerns. All right, so if you have any question, please write.